Tay Sachs disease is a genetic disease where the body is not able to break down fatty compounds called gangliosides. These gangliosides build up in the brain and damage nerve cells. A normal person has the enzyme hex A to break down these gangliosides, but a person with Tay Sachs disease does not produce any hex A. Therefore, these gangliosides damage nerve cells to the point they can no longer properly function. There are two types of Tay Sachs disease. One called LOTS, or onset. This happens later in one's life. There's also one that is the most common type, that develops during infancy. This is called infantile Tay Sachs. At birth, a baby may seem completely healthy, as symptoms appear 3 to 6 months after birth. At 3 to 6 months after birth, the symptoms begin with mild motor weakness and occasional eye and body twitches. Over time, the conditions quickly worsen. This involves blindness, deafness, paralysis, and seizures. The death of a child is usually around the age 4, although the oldest survivor of infantile Tay Sachs has been 9 years old and is still living today. A person can be tested to see if they are a carrier of this disease through blood. If you are pregnant and both parents are carriers, you are able to see if your unborn baby has Tay Sachs through looking at the genes. You can also see if your baby has Tay Sachs to attempt to slow nerve damage before birth. Babies can be tested for Tay Sachs by taking samples from the umbilical cord after birth. If a child is showing apparent symptoms, a doctor can perform physical exams, look at family history, or an eye exam for looking for a red spot on the manticula. This genetic trait is passed down through family members and is 1 in 4 chance that parents with two carriers will have a child of Tay Sachs. This genetic disease is most common among Ashanti Jews, or people whose families descended from the Jewish communities in Central or Eastern Europe. Approximately 1 in 30 people of this population are carriers of the Tay Sachs disease. The question is this horrible disease curable? It is not. Although it's not curable, you can cure the symptoms or just keep the child comfortable. This type of care is called palliative care. Palliative care includes medication for pain and anti-epileptics to control seizures, as well as physical therapy, feeding tubes, and respiratory care to reduce mucus buildup in the lungs. Although this isn't provided by doctors, one of the most important supports is a family support for the child and just loving the child as much as possible through this horrible traumatic experience. There are also many communities and groups whose children also have this and people who are supporting this cause. There are 2 major players in this support groups. There's National Tay Sachs and Allied Diseases Association, which is NTSAD, as well as the Cure Tay Sachs Foundation, or the CTSF, which is looking to find a cure for this horrible disease. There is one child that has proven his strength. This is Seth Spearfish. He is currently the oldest person to be living with infantile Tay Sachs. Seth was born on February 23, 2002. Currently, Seth is in a paralysis state and is unable to do things that we find simple, such as walking, talking, and he comes in at weighing only 70 pounds. Although it's a struggle, Seth is cared for by his family, and as well as a team of nurses who help care for Seth around the clock. Seth isn't giving up on this long-lasting battle against Tay Sachs, and he is inspiring and bringing hope to everyone who hears his story. The Cure for Tay Sachs Foundation came up with a mural of many children that have Tay Sachs.